Hello everyone, welcome to Med-Surg Mentor. Today let's see a very important heart condition which is also a frequently asked question for both BSc and MSc nursing students. So let's begin. Let's see heart failure in detail. Let's start with the definition of heart failure. Heart failure is a condition in which the heart cannot pump enough blood to meet the metabolic needs of the body. Now let's move on to the etiologies of heart failure. Those are abnormal volume overload, abnormal pressure load, myocardial dysfunction, filling disorders, and increased metabolic demand. Let's see the first etiology in detail, and this is the abnormal volume overload. In this, there is increased circulatory volume, which forces heart to overwork, leading to heart failure. And the conditions are valvular incompetence, overtransfusion, left to right shunt, and secondary hypervolemia. The second etiology is abnormal pressure load. Some examples causing abnormal pressure load are aortic stenosis, hypertrophic cardiomyopathy, and hypertension. Next etiology is myocardial dysfunction. Some examples of diseases causing myocardial dysfunction are cardiomyopathy, myocarditis, ischemia or infarction, and arrhythmias. Common filling disorders leading to heart failure are mitral or tricuspid stenosis, cardiac tamponade, and restrictive pericarditis. The last etiology is increased metabolic demand. Some of the examples are anemia, thyrotoxicosis, beriberi, and arteriovenous fistula. These conditions initially increase the stress on heart, but over time, the demands due to increased workload may lead to cardiac hypertrophy and heart failure. The common risk factors of heart failure are high blood pressure, coronary artery disease, heart attack, diabetes mellitus, medications like non-steroid anti-inflammatory drugs, sleep apnea, irregular heartbeat, congenital heart defects, valvular heart diseases, viruses, alcohol, tobacco use, and obesity. Stages of heart failure. There are three progressive stages for heart failure, and the first stage is called initial stage, second one is intermediate stage, and the last stage is irreversible stage. Initial stage. At the initial stage, the compensatory mechanisms get activated by nervous and hormonal systems. Compensation may help the body to adjust to the effects of the heart failure in the short term, and thus it increases the heart rate, stroke volume, and the cardiac output, and temporarily helps the heart to maintain the cardiac output. The second stage is intermediate stage. In this stage, the compensatory mechanisms are failed, which is leading to reduced cardiac output, and as a result, there is reduced tissue perfusion, which is leading to organ damage, which in turn leads to further reduction in the cardiac output. The third stage is called irreversible stage. The key features of the stage are non-functioning compensatory mechanisms, reduced cardiac output and stroke volume, diminished organ function, and irreversible damage to the heart. Pathophysiology of heart failure. Due to the etiological factors, there is a reduction in the cardiac output. As a result, carotid baroreceptors get activated, and as a response, there is increased sympathetic nervous system activity. Due to this, heart rate and myocardial contraction increases. As a result of this, there is vasoconstriction and increased blood pressure. In other words, it increases the afterload of heart, thus leading to heart failure. At the same time, due to the reduced cardiac output, kidneys are also receiving low blood supply. Due to this reason, renin-angiotensin-aldosterone mechanism get activated. In this stage, kidneys produce renin, which convert angiotensinogen to angiotensin 1. Then angiotensin converting enzyme converts angiotensin 1 to angiotensin 2. Angiotensin 2 is a potent vasoconstrictor. In the next stage, angiotensin 2 acts on adrenal gland secreting hormone aldosterone. Aldosterone helps in sodium and fluid retention. At the same time, it acts at the pituitary gland which secrete antidiuretic hormone. It helps in fluid retention. Ultimately, it increases the workload of the heart and causes worsening of the left ventricular function, which is leading to heart failure. Now let's move on to the clinical features of heart failure. In left heart failure, the prominent clinical feature is pulmonary congestion. When the heart cannot pump blood effectively, there can be backup of blood into the pulmonary veins that take blood through the lungs. As the pressure in these blood vessels increase, the fluid is pushed back into the alveoli, which is resulting in the pulmonary congestion and pulmonary symptoms. But in right heart failure, the prominent clinical feature is edema. It occurs due to the systemic venous congestion. Here, the right side of the heart is weakened and results in backup of blood into the veins, causing swelling in the legs, abdomen, and ankles. Subjective findings of heart failure. In left heart failure, the findings are shortness of breath, cough, fatigue, memory loss, confusion, diaphoresis, palpitation, anorexia, and insomnia. In right heart failure, the findings are weight gain, ankle swelling, abdominal distension, anorexia, and nausea. Objective findings of heart failure. In left heart failure, the findings are tachycardia, reduced S1 sound, S3, S4 gallop, crackles, diaphoresis, pulsus alternans, increased pulmonary artery wedge pressure, decreased cardiac index, and increased systemic vascular resistance. And in right heart failure, findings are neck vein distension, increased jugular venous pressure, increased central venous pressure, edema, hepatomegaly, positive hepatojugular reflex, and ascites. Types of heart failure. It is mainly categorized into three, and the first category is left ventricular failure versus right ventricular failure. In left ventricular failure, as the name indicates, the left ventricle is failed to work, resulting in pulmonary congestion. In right ventricular failure, the right ventricle is failed to function, resulting in systemic congestion. And the second category is backward versus forward heart failure. In backwards heart failure, it results from failure of one or both ventricles to fill normally and discharge its contents, causing back pressure on the atria and the venous system. In forward heart failure, it results from inadequate discharge of blood into arterial system, leading to poor tissue perfusion and excess sodium reabsorption. And the third category is high output versus low output heart failure. In high output heart failure, it happens when the body's need for blood is unusually high. It occurs in conditions like anemia and hyperthyroidism. In low output heart failure, it occurs when the heart is not pumping enough blood to meet the demands of the body. It can be caused by diseases like congenital heart disease, low blood pressure, and heart diseases. Next is New York Heart Association classification. It is mainly categorized into four: Class 1, Class 2, Class 3, and Class 4. In Class 1, there's no symptoms and there's no limitation in the ordinary physical activity. In Class 2, there are mild symptoms like shortness of breath and angina, and there is slight limitation during ordinary activity. In class 3, there is marked limitation in the activity due to symptoms even during less than ordinary activity, for example, walking short distances. And in class 4, there is severe limitation and the patient experiences symptoms even at rest. Next is American Heart Association classification based on stages of heart failure. It is mainly divided into 4: Stage A, Stage B, Stage C, and Stage D. In Stage A, the patient is at high risk for heart failure, but without structural heart disease or symptoms of heart failure. In Stage B, there is structural heart disease, but without signs and symptoms of heart failure. In Stage C, there is structural heart disease with prior or current symptoms of heart failure. In Stage D, there is refractory heart failure requiring specialized interventions. Now let's see the diagnostic measures in detail. Common system-wise assessment findings seen in heart failure are tachycardia, pulses alternans, which means alternating strong and weak beats with normal rate and interval, S3 and S4 sounds, which occurs due to the impaired diastolic function, jugular venous pulses, pulmonary crackles due to fluid collection in the lung, edema, hepatosplenomegaly, cyanosis, positive hepatojugular reflex. Now let's see in brief about hepatojugular reflex. It is the distension of the neck vein precipitated by firm pressure over the liver. For this, the patient is positioned supine with elevation of the head at 45 degrees and look at the jugular pulsations during quiet respirations, and then apply gentle pressure over the right upper quadrant for at least 10 seconds. An increase in the jugular venous pressure more than 3 cm is considered as positive. The next diagnostic measure is blood test. There are two kinds of natriuretic peptides that are currently available for the diagnosis of heart failure. Those are B-type natriuretic peptide and pro-B-type natriuretic peptide. Blood levels of both of these substances become elevated in patients with congestive heart failure. This is a hormone produced by the left ventricle. And the other blood tests that are commonly done are metabolic panel, complete blood count, and thyroid test. The third diagnostic measure is chest X-ray. It is done to identify the structural changes of the heart and lungs. By this chest X-ray, we can identify heart enlargements and fluid presence in the lungs. The next diagnostic measure is ECG, electrocardiogram. The common findings in ECG are prolonged QRS duration, left ventricular hypertrophy, left or right axis deviation, ST T wave abnormalities, and prolonged QT interval. Next diagnostic measure is stress test. Stress test measures the health of the heart by how it responds to exertion. Patient is asked to walk on a treadmill while attached to an ECG machine or may receive a drug intravenously that stimulates the heart similar to exercise. Doppler two-dimensional echocardiography. This test helps to identify the size and shape of the heart along with any abnormalities. It also helps in diagnosing valvular changes, pericardial effusion, chamber enlargements, ventricular hypertrophy, and ejection fraction. Next diagnostic measure is cardiac catheterization. It helps to identify the pressure and blood flow within the chambers of the heart. The most significant finding of right heart catheterization is increased pulmonary artery wedge pressure. It denotes ventricular failure. Other common diagnostic measures are ABG analysis, myocardial biopsy, coronary angiography, CT scan and MRI. Common complications of heart failure are kidney damage or failure, heart valve problems, arrhythmias, liver damage, and anemia. Now let's move on to the medical management of heart failure. The commonly used drugs are angiotensin converting enzyme inhibitors, angiotensin II receptor blockers, beta blockers, diuretics, aldosterone antagonist, inotropes, and digoxin. Now let's see the surgical measures of heart failure. The common surgeries done are coronary artery bypass graft, heart valve repair or replacement, implantable cardioverter defibrillators, cardiac resynchronization therapy, ventricular assist devices, heart transplantation, and intra-aortic balloon pump. Let's see each surgeries in detail. And the first surgery is coronary artery bypass graft surgery. It is done if the blocked artery is the reason for heart failure. In this procedure, the blocked artery is replaced with blood vessels from leg, arm, or chest to replenish the blood flow through the heart. The second surgical measure used to treat heart failure is heart valve repair or replacement. It is done if the reason for heart failure is a defective or faulty heart valve. Here, the valve is either repaired or replaced with an artificial valve. The common procedures done are annuloplasty, valve repair, prosthetic valve implantation. The third surgical procedure done to manage heart failure is implantable cardioverter defibrillator. An ICD is a device similar to the pacemaker. It is implanted under the skin in the chest with wires leading through the veins into the heart. ICD monitors the heart rhythm. If the heart starts beating at a dangerous rhythm or if it stops, the ICD tries to pace the heart or shock it back to the normal rhythm. The next surgical measure is cardiac resynchronization therapy. It is also called biventricular pacing. It sends timed electrical impulses to the lower chambers of the heart so that it can pump in a more efficient and coordinated manner. Ventricular assist devices. It is also known as mechanical circulatory support devices. It is an implantable mechanical pump that helps to pump blood from the lower chambers of the heart to the rest of the body. Next surgical management is heart transplantation. It is done on patients with end-stage heart failure. In this procedure, the diseased heart is replaced with a healthy donor heart. The last surgical management is intra-aortic balloon pump. It is a short-term treatment for heart failure. It can be used until the heart condition improves or until receiving a permanent treatment. It is done by balloon tip catheter and the working is divided into two stages. The first stage is the deflation in systole. Thus, it creates a low pressure in the aorta. And the second stage is the inflation and the diastole. Thus, it increases the coronary blood flow. Lifestyle modification for patient with heart failure. Smoking cessation, healthy weight maintenance, daily check for edema, healthy diet, sodium restriction, fat restriction, active lifestyle, stress management, alcohol and fluid restriction. Common nursing diagnoses for heart failure are decreased cardiac output, impaired tissue perfusion, ineffective breathing pattern, ineffective airway clearance, impaired gas exchange, and excess fluid volume. And other common nursing diagnoses are deficient knowledge, hypothermia, risk for impaired gas exchange, risk for impaired skin integrity, and activity intolerance. Nursing care in heart failure. Maintain intake-output chart, high follows position with leg elevation, correct electrolyte imbalances, sodium and water restriction, inspect skin for changes, auscultate for abnormal heart and lung sounds. Other nursing care includes help with activities of daily living, ensure adequate rest, encourage active and passive exercises, administer supplemental oxygen, reposition every 2 hours, provide quiet environment, and increase activity as tolerated. So far, we have discussed regarding heart failure, its etiology, risk factors, pathophysiology, clinical features, diagnostic measures, management, and nursing care. If you find this video helpful, please like, share, and subscribe. Thank you.